we'll open it up to the group. You can unmute yourselves. We'll give you a minute to do so. And if you have any suggestions, ideas, like Jessica has noted here in her slide for service and practice events, podcasts, and other ways to connect, feel free to unmute. Or if you have any questions or comments for Jessica, feel free to speak up or note it in the chat room. So this is really, really fascinating, Jessica. I appreciate you speaking to us tonight. And I do have so many ideas, starting in my head. So I look forward to sharing them with you. I think I need to just formulate them a little bit more.
Absolutely.
So but maybe you can expand upon the podcast. I guess, how did that get started? And
yeah, that's a good question. So that was one of those fun projects. Again, thinking within the scope of the school and what you're able to do. This is back about a year ago when podcasts were really all the rage and everyone was really excited, and they were becoming very trendy, when a colleague of mine, Naya Villarreal in the Gilligan's Global Gateway, she mentioned it would be like a neat partnership to think about telling stories across the whole school. And that's been really, it's such a valuable, and I don't want to say easy, but it takes, when you compare hosting an event and all the time it takes to prep an event, and then it's done, even if you record it, I feel like it hasn't had the download or the download rate or the spread that a podcast episode has. And particularly with Zika and the refugee crisis that are all global issues, it's been really fascinating to see the number of countries that have downloaded this. And even though we recorded them, the last season was from last year. The new episodes are going to be coming up in the end of November. They're still getting downloaded all the time. So I would really recommend, if you're trying to get information out there to your audiences, that a podcast is a really neat opportunity for you to do that. And we do it in a very low budget way. We use our cell phones. We use the voice memo app. We bought some very good microphones, the lavalier ones that can plug into your phone. But those really good ones were only $75 off of Amazon. So right there, we've spent $75. You can edit it using apps that are at no cost on your computer. And then we pay $20 a month to Libsyn, which is short for Liberated Syndication, to host our podcast. And that $20 a month gives us the data that shows us geographically where our downloads are happening by episode, by day. You can see trends, so you can link it to whether or not possibly people are getting connected into it from listservs. But I'd be happy to talk more with people about that. The refugee crisis, there was a 3-part series. It was one of those things where you come in naively, it's a big issue to cover, and we ended up doing it in 3 parts because there was just so much to at least go over at that point. My favorite episode has been the diaper bank episode, just because it's such a good story. And there's something tangible that you can do. If you haven't had a chance to connect with the diaper bank, I highly recommend that you do. And that's a really, really great group locally that's doing work across the state here.
Yes, this is Gene Perry. How interactive is your podcast? I mean, do you get an opportunity to interact with your audience?
Good question. We have thought about adding in a call for audio or a call for questions at the end of an episode. So all of the podcasts, I describe a podcast in the easiest way. It's almost like a radio show that you can download and play on demand. And many radio shows now actually have a podcast of their version. So when you're listening to it, there's not really an opportunity for immediate interaction. But I like that comment, because we thought about having an opportunity where we pose a question to listeners and have them submit audio to reflect on that. So that's one strategy we've considered. That's a good question.
Also, I have another observation. First off, you're doing a lot of work, number one. But in the North Durham Rotary Club, we had a visitor. He started working for the state, and I think it was in the health field. But one of his early observations was that there's some inefficiencies with a lot of organizations who do a lot of good things for the communities, but there's very little coordination. So sometimes there's inefficiency in the good acts that they actually wind up doing. For instance, yesterday we were packing, I guess they were from school backpacks, but we must have 1,000 in this state. And I'm from New York, and I've never even heard of this phenomenon. But can you comment on that?
That is something I love to hear, because I'm constantly thinking about how do you get better, and how do you understand the limits of what you're able to do. And to be honest about that, I think we all want to do really amazing things, but making sure that, particularly with community partners, that engagement piece, it takes a lot of time, and it takes building trust and following back up. So with Rena, we've been very thoughtful to at least do a touch point every month or so, not even with an ask, but just checking in on how they're doing, and if there's anything else that we can do to support the work that they're doing. So yeah, it continues to be an issue to coordinate across those big efforts as partners.
Great questions, Jean. Any others? So Jessica, I did have another question. How do you market your podcast? So you were saying that they're being downloaded in other countries. So how do those people find out? Are you able to tell through surveys, or how are those decisions made in order to get the word out?
That's a great question too. We haven't surveyed yet, so we don't know who the population is that's actually downloading the podcast. But we can tell that when we send out our Global Gateway newsletter, that downloads seem to spike on that day. So we've taken that as a hint, and that perhaps it might be linked to the link that's in that newsletter. That's a good question. We've also, what I think is magic with having the transcript for the podcast, it takes a lot of time to transcribe it. But as I mentioned, it helps make it more accessible. So if you have any disabilities with hearing and you can read, that's one way that you could be able to view it. But we do some active hyperlinks within the text of the podcast, and then we share it with our partners. So the Zika one, it included folks from a number of different organizations. I think that one had a lot of downloads because they also then were able to share that electronic link to the podcast with their partners and organizations. And so folks will be able to download it that way. We were a bit strategic at the start of it. There was the APHA conference, which is a national public health conference. We mentioned them a lot in one of our podcasts, and so they were able to promote it on Facebook, which had thousands of people that were following them. So connecting in partners, giving them a nod, helping to share some of the content that we have that helps with their social media reach, I think was useful. But then we also, I have to say, when I'm watching my husband, who started this brand new radio show from scratch, and he's creating listeners just by, basic grassroots networking, he's having a harder time because we're coming in with a brand of UNC Gilling School of Global Public Health that has a lot of people that are already following that. So I think that has something to add. But that, it's the 15,000 downloads stuff seems big, but then you think about the bigger podcasts that have millions each day. It is an interesting thing to experience, but it's been one of the more tangible data related ways that you can show that you're having reach and impact.
That's awesome. And as an idea for events, podcasts, service practice, have you connected with the Rotary Peace Center? That's literally like right there at the Global FedEx Center.
Right. We haven't connected with them directly, but we've interviewed, a couple of the students that have come through there. Rebecca Bartlett, most recently with her MADAPT app, if you've heard about that. It's a mobile app that she's developing for use with refugee families to connect them to maternal and child health resources abroad. But yes, I would love to work more directly with them. That's a great suggestion in the work that they're doing.
So like, for example, we have, you know, Dilshad, and then we also have Osborne here, who's also online tonight with us.
Right.
Both Peace Fellow alums, and then they have their Peace Fellow spring conferences so I heard about MADAPT last spring, April, when the graduating fellows presented to I thought,
okay, yeah. That would be an interesting one to cover with multiple topics, and we've done something similar with our practicum day. So yeah, I would love to stay in touch on that event for sure.
Awesome.
And any other opportunities that you can think of, that's great.
Definitely. So
are there topics that folks were hoping that we would touch on today that I could maybe speak a little bit more about, or that we could all talk about together?
Hey guys, this is Eve. I'm sorry, I was really trying to get off mute forever and I couldn't quite figure it out. But I wanted to ask about any like kind of domestic issues, especially around the hurricane relief, and how you're seeing, just to tie into Jean's question, some kind of coordination of all the groups and how they're kind of working together. And I know it's kind of an abstract question, but if you could speak on that a little bit, if you've heard anything about that.
Thank you so much. So I'll tell you what UNC is doing. The UNC has a Carolina Center for Public Service. I don't know if you've connected with them yet, but they're serving as like a hub for all the different efforts that are happening throughout the school. So we have student groups who work with very specific populations who are doing, we're calling it humanitarian aid at this point. So a lot of donation, coordination, and what they're doing. If you go to their website, and I can share this link afterwards. They're basically listing all the different opportunities that they know of, similar to my page, where we talk about public health, but theirs is for, at UNC, here's all the different things that are going on. And I think thinking about coordination, the emergency preparedness piece really comes into play. Before something like this happens, you really have to have those partnerships already in place, and an understanding of what you're going to do to help support them, and not to be a hindrance. After an emergency, people always come out, and handling the volunteers is a whole piece of the response in itself. So the UNC side right now, that's how we're approaching the coordination piece. At the School of Public Health, we're sharing with the Carolina Center for Public Service what we're doing, so that if people are interested and want to contribute specifically to what we're doing, that's great. But we don't have partnerships like, other than with local health departments on how to support what they're doing. But then you run into some policy issues where we really need to let the state do their response and only respond if requested. So we've kind of gone around that in a little bit of way of promoting with our health department partners the different services that we can offer, and saying that when they are ready, if they want to request those services up the chain of command through DPH, then DPH knows that we're ready to go with those things. So it's always a challenge, and communities. It is interesting. Like we'll give all these communities a needed attention right now after Matthew when they've needed it before. So you really have to be cautious about who you're working with, and you're not just coming right on in. And Rogers Eubanks Neighborhood Association, they have a lot of their faith-based partners in some of the communities affected, so they've been working through those relationships that they've had. And I think that's the lesson I've learned, is go to the people who have the relationships and see what needs that they have that you can support. I hope that kind of answers your question.
No, that really helps. That was actually a lot of information, and I appreciate it. So I may be touching base with you again. So thank you. I really appreciate that. Thanks.
Oh, good.
Thanks, Eve, for that question. So Jessica, we're at the top of the hour, so I want to thank you for being here this evening, and we'd like to present you this.